Well, finding a doctor could someday be much harder. According to the Association of American Medical Colleges, by 2034, the U.S. could be short more than 120,000 physicians.
News 8 Now's Rob Romano found out what our local hospitals are doing to prepare for that shortage. Rob.
Amy and Ken, even before the COVID-19 pandemic, in 2019, the Association of American Medical Colleges said our country had nearly 20,000 fewer doctors than required to meet our nation's healthcare needs. Now in 2022, our local healthcare systems are making preparations for any future shortages.
It could become scary. People should be outreached more.
Michael Watts recalls a time when he wanted to see a psychiatrist in the La Crosse area, but wasn't able to. Following that experience, he's concerned about anyone in a worse situation.
What if it's someone that's very much serious, you know?
Gunderson Health CEO Dr. Scott Rathgaber says the hospital has been preparing for potential shortages of physicians for a while. 6 years ago, Gunderson created an additional residency program for family medicine to beef up staffing levels.
Understanding that we needed more folks, we decided to fund the residency out of our own funds.
Rathgaber says Gunderson is not exempt from staffing issues. The hospital is only able to hire so many resident physicians because, like other hospitals, it can only get reimbursed from the government for a certain amount of hires. On Thursday, Rathgaber acknowledged that the high cost of a medical school education is making it harder for people to become doctors.
And I think there's only so much of that people can carry. And my own situation is I'm seeing loans of 10 times more than what I carried when I came out of school, admittedly 35 years ago. But those kind of increases are really burdensome for folks and barriers to them getting into these careers.
Meanwhile, at Mayo Clinic Health System, family medicine physician Dr. Paul Moling acknowledges that staffing shortages are being felt, but that it's mainly due to an aging population.
I think we all knew this was coming. I mean, if you look at it, what's happening, the complexity of care is going up. Each day, 10,000 baby boomers are turning 65.
In late 2020, Congress passed legislation to allow for 1,000 additional graduate medical education positions nationwide. As for Watts, he just hopes that hospitals make mental health care more of a priority as they grapple with staffing issues.
But I do believe they need help. They need a lot more work in that field, a lot more doctors.
And 11% of doctors nationwide practice in rural areas, despite 20% of the population living in them. Amy and Ken, I'll send it back to you.
All right, thanks, Rob. The Association of American Medical Colleges says also by 2034, the U.S. could be short up to 48,000 primary care physicians.